places like Australia think that poor outcomes are a problem of low and middle income countries, but everywhere we look in the data sets that we've got in New South Wales, we see differences in outcome based on where you live, how much money you have and what your race is. We call it a postcode lottery, although it's not just about geography. So clearly people living in two different neighbourhoods can have completely different outcomes related to cancer treatment. And it's also not just an access problem. So it's often been seen as what you've got to do is put radiotherapy machines in the country. But if the person can't afford to leave the farm for the 6 weeks of treatment and stay there or have other caring responsibilities, they indeed don't take up the treatment because they're poor. So we need to really understand the variations that there are in outcomes and explore in a much more granular way the reasons for that. So we've been doing some work in New South Wales, for example, looking at volume outcome relationships in rare and complex surgery like esophageal and pancreatic surgery. And our outcomes mimic all of the international data that says higher volume centres do have better outcomes, and yet we still have 30 different hospitals performing 150 pancreatectomies, and it's seen as restraint of trade for doctors. No, this is not about doctors, this is about creating a great system of care around the patient. The other thing we see variation in by postcode is the proportion of people diagnosed with those cancers who actually get through to surgery. So not only might you get your surgery in a low volume centre, your chance of even having a curative option varies depending on where you live. And we have to remove that variation from the system and make sure that we have quality cancer care for everyone. Perhaps our biggest issue in Australia is the outcomes for Aboriginal Australians. If you're an Aboriginal woman diagnosed with cervical cancer, your chance of dying of that cancer is up to 27 times that than of being non-Aboriginal. This is simply unacceptable, and we know very little about the reasons for that. It's not completely explained by stage of disease at diagnosis, so there are lots of other factors that we need to understand in much more granularity. And while we as a country have some of the best cancer outcomes in the world, it's 66% 5-year survival. For Aboriginal people, it's only 40%. This is not something that we should just say is not all of our responsibility. We have to collectively understand the reasons for these disparities and seek to address it.